Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, and we're going to be covering the nursing care of the infant and toddler. Now, before we get started, as always, I'm going to ask you to please support me and support this channel. You can support me by liking this video. You're going to love it, so go ahead and give it a thumbs up now. Subscribe to my channel if you have done so already, and don't forget I'm now offering next generation NCLEX review sessions, both part 1 and part 2. You can reserve your spot by going to my website nexusnursinginstitute.com. If you are a current nursing student, you're not studying for boards, you just need a pass, you're trying to get through the program, well, I have something for you. Audio lessons. You can check that out by going to my website, again, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms, such as TikTok, Instagram, Facebook, and of course on here, YouTube. My handle is the same everywhere, Nexus Nursing. Without any further ado, guys, let's get started. Nursing care of the infant. Okay, first question. Which developmental milestone is expected for the 3-month-old infant? Would it be the infant can hold a bottle, the infant can lift his or her head and shoulders, the infant can roll from back to abdomen, or the infant can sit unsupported? Which would you choose as your answer? Which developmental milestone is expected for the 3-month-old infant? Okay, guys, most of you guys chose the correct answer, and it's the infant can lift his or her head, shoulders. So we're talking about a 3-month-old. By 3 months, they should be able to lift their head and shoulders about 45 to 90 degrees. Okay. All of the other options we'll see around 4 to 6 months that, they can hold the bottle on their own. They have that voluntary grasp that they're turning from back to stomach, stomach to back. The infant can sit unsupported. All of those other options we'll see around 4 to 6 months. You just gave the MMR vaccine to your 15-month-old patient. Which would you teach as a priority to report immediately? Would it be to report a fever within a week of the immunization, appearance of a rash 3 to 4 days after immunization, crying for more than 2 hours even after comfort measures are taken, or redness and swelling at the injection site? Okay, the correct answer is crying for more than 2 hours. Now, here's the key. Even after comfort measures are taken. What does that mean? So if that child is still crying even after comfort measures are taken, that means that that child is not consolable. Whenever you have an infant that cannot be consoled, something is wrong. There is a need that is not being met. Most likely that patient's in pain, but it can be something else, okay? We're not dealing with toddlers or children where they actually can manipulate, they can be manipulative, where they'll cry just to get their way. No, infants don't know anything about that. If you're offering comfort measures, you're consoling an infant and they're still crying despite being consoled, there is a need that is not being met. Okay, so that's what needs to be reported immediately. Something is wrong. Now, we have a 15-month-old. We gave the MMR vaccine. All of these other options are side effects that you're going to warn the parents about. You're going to warn them that they may get a fever within the week of that immunization. They may develop a rash about 3 to 4 days after the immunization, and there may be redness or swelling at the injection sites. Those are side effects that you are going to warn them ahead of time. What childhood safety issue would be of concern regarding a 12-month-old? Would it be no tablecloths on the table, the patient ambulating while they're eating, furniture edges being rounded, or them building a tower with large blocks? Which would you be concerned about in a 12-month-old patient? Okay, good. Most of you guys chose the correct answer. Ambulating while eating. Why are we concerned about them choking? We're worried about that patient choking. All of the other choices, nothing's wrong with it. No tablecloths on the table. That's a good thing because guess what? At 12 months, they're going to be standing. They're going to be walking. Okay. We don't want anything that child can just pull down. If they're pulling down that tablecloth, everything that's on that table can fall on the patient. Furniture edges being rounded, good. We want it rounded. We don't want it sharp where the patient can injure themselves. And then building a tower with large blocks, good. We want the blocks to be large and not small because if they're small, guess what's the first thing the patient's going to do? Try to put it in their mouth. We don't want a choking hazard. You're teaching about the introduction of solid foods. Which response indicates a need for further teaching? Would it be, we will start with cereal that's iron fortified? Would it be, we won't breast or bottle feed until after solids have been started? Would it be, we will introduce one food at a time every 4 to 7 days? Or would it be, we'll postpone giving solid foods if the protrusion reflex is still present? Okay. We won't breastfeed or bottle feed until after solid foods have been started. That requires further teaching because we're looking for the wrong answer choice. Guys, these infants, these newborns, guess what they're going to start on? They're going to start on breast milk, formula, or both. We do not introduce solids until what? 6 months. Okay, so that's the one that we're going to correct. All of the other choices are good. The first one, we're going to start with rice cereal um that's iron fortified. Absolutely. When you start with solids, you're going to start with rice with cereal that's iron fortified. That's wonderful. Why? Number one, iron helps with the absorption. Excuse me, iron helps with the production of hemoglobin. And think about it, these infants, once they hit like around 5, 6 months, 4, 5, 6 months, their maternal iron stores go down, right? So they're at higher risk for being anemic. So that's the perfect time when we're starting those solids. We're going to start them with a cereal that's iron fortified because we know that iron is going to help them get their hemoglobin up. That's number one. And number two, that cereal, it's not hard on the stomach. It's easily digestible. So that's wonderful. That's a great answer. That does not require further teaching. The next one, we'll introduce one food at a time every 4 to 7 days. Wonderful. You never want to introduce foods mixed. Why? If that child becomes allergic, you're not going to know what they're allergic to. So you're going to introduce a new food once at a time, every 4 to 7 days. So if that child does become allergic to something, you'll know what they're allergic to. So that's perfect. And then we'll postpone giving solids if the protrusion reflex is present. That's wonderful. That protrusion reflex, that's where they automatically will push their tongue out. So whatever food is in their mouth, they're going to automatically push it out. Absolutely. You're going to want to postpone until that protrusion reflex has disappeared. Otherwise, that's a choking hazard, right? And how effective are you going to be feeding that patient? So the only one that is bad, that requires further intervention or further teaching, is when they say they're going to start with solids. Absolutely not. You start with solids at 6 months. All right, in regards to the toddler, which observation by the nurse requires additional teaching? So we're looking for another wrong answer choice. Here are your choices. Household chemicals that are stored in their original containers, medications and chemicals that are placed high away on a shelf from the patient's reach, the phone number to the poison control center, or having the hot water heater set at 120 degrees. Which one requires additional teaching? Okay, most of you guys chose having the hot water heater set at 120 degrees. And that is not the right answer. That is fine. That is fine. Making sure you have the phone number to the poison control center. You want to have it somewhere near a telephone or somewhere displayed prominent, like on a refrigerator or the door where everyone can see it. And of course, having all the chemicals in their original container. All of those are good things to do. Let me tell you what is not a good thing to do. The medications and chemicals placed on a high shelf away from the patient's reach. Let me explain this to you. And this is a trick question. NCLEX is very big on this. They expect you to know this. We're dealing with toddlers. What can toddlers do? Walk, run, and what else? Climb. So you putting that dangerous chemical or medication somewhere high away from the toddler's reach, that means nothing because they know how to climb. What you're going to do is have it what? Locked away. That is the key. Anything that is dangerous, any chemicals, any medications, they need to be locked away. That is your key because children know how to climb. So don't fall for it. All right, here's a puzzle. Sequence the list of actions from birth through the infant's first year of life. So you have to go in order from birth to the first year of life. Here's your choices. Covering the electrical outlets and turning pot handles inward, removing stuffed animals with small pieces from the child's grasp. Let me move this. Sorry, guys. Maintaining water temperature under 120 degrees and having straps on the changing table, and lowering the crib mattress. Excuse me. Put it in order according to the infant stage of development from birth to the end of that first year. Actually, this is a good question, and you'll see why. I'm about to answer it. It'll make sense once I answer it. Here's your answer. So the first thing you're going to want to do is maintain water temp under the 120, have the straps on the changing table, right? When we have a newborn, they can't walk, they can't run, they can't climb, right? They can't even turn over yet, or maybe they can, it's just a newborn. You want to make sure that the water's not too hot because their skin's very fragile. And when you're changing them, you want to make sure there's straps on that table because guess what? Even though they haven't turned yet, you don't know when they're going to develop that milestone, when they're going to reach that milestone. Next, removing stuffed animals with small pieces from the child's grasp. Why? Because that child will have to be able to grasp a small piece and put it in their mouth. Next, covering electrical outlets and turning the pot handles inward. Well, in order to get to the electrical outlets, they'll have to at least know how to what? Crawl, right? Crawl or walk. So they're crawling now at the minimum to get to those outlets. And the reason you're going to turn the pot handles inward is because if they know how to walk, guess what they're going to do? They're going to walk by that stove and they could pull on that pot handle and whatever's on that pot can fall on the patient, right? And last, lowering the crib mattress. Why would we do that? Because now they know how to climb. Because to get out of that crib, they have to climb out. So we go from them rolling to pull something and put it in their mouth, having that grasping, to them actually crawling or walking, to them climbing. Okay? These are the different developmental milestones that you need to think about for the infant. Select all that applies. Which foods can be introduced to the infant during the first year of life? Select all that applies. So during the first year of life, we're talking about infancy, birth to 1 year. Here's your choices. Toast with honey, pureed fruits, whole grapes, oatmeal cereal, strained vegetables, fruit juice. These are your choices. Which of these food items can you safely introduce the first year of life? Okay, let's talk about it. So the correct answer is pureed fruits, oatmeal cereal, strained vegetables. By the way, guys, you're going to want to offer the veggies before the fruits, because if they get the taste of the sweet fruit, you think they're going to want to eat the veggie? And no. Okay. But anyways, when we're starting solids, you're going to start with the pureed fruits, the cereal, the oatmeal cereal, the strained veggies. They're easily digestible, and the risk of development of allergies is low. Now let's talk about the wrong answer choice. Oh, that girl Nana said, why no juice? Okay, I'm about to answer. Give me a second. So let's go in order. Let's talk about toast with honey. The reason we're not going to do that is because of the honey. We do not give honey to infants. Why? What are we concerned about? Botulism. So we're staying away from honey. Next, whole grapes. Guess what? What shape are grapes? And notice it said whole grapes. So it's not cut up grapes, it's a whole grape. It's circular. That grape can get stuck in the patient's throat and cause an occlusion of the airway. So if you're going to give the patient something round, such as grapes or even hot dogs, you have to cut through it so that it's at an angle. Okay. So even if it gets stuck in the patient's throat, the airway is not completely occluded. There's still some air getting through, so you can have more time to get help. And last, fruit juice. Here is why you do not give fruit juice to the infant the first year of life. It's not necessary. That's just extra sugars that you're giving that patient that's not necessary, okay? The first year of life, the first 6 months is going to be breast milk, formula milk, formula, or both. We're not even giving them water. It is not necessary. That fluid is just taking space where they can get vitamins, nutrients, minerals that are needed. At 6 months, when we start solids, they'll have their solids when that patient turns 1 year old. 1 year old. That's when they'll go from either formula or breast milk to whole milk, right? Because that fat from the cow's milk, once that patient turns 1 year old, from 1 to 3, there's just a very rapid growth during that toddler stage, and that fat in the milk is needed for that rapid time of growth. But fruit juice is not needed at all. Milk, breast milk, formula, or both is sufficient. Fruit juice should not be given to an infant. That child in the first year should not be getting fruit juice at all. I don't care if it's apple juice. I don't care if it's orange juice. If it's juice, they should not be getting it. And don't fight with me, fight with NCLEX. All right, puzzle. Place the developmental activities for an infant in order of occurrence from earliest to latest. So again, you're going to put it in order of that infant's milestone. So here are your choices: them having the ability to crawl on hands and knees, them having the ability to sit alone, them having the ability to use the pincer grasp. That's when you use, oh, can you guys see me? There we go. That's where they can use their finger, their index and thumb finger, index and thumb, excuse me, to pick up smaller objects. And of course, turning from prone to supine and supine to prone. Put it in order. Lena, the pincer grasp is when the child can do this. They can pick up smaller items with their index and thumb. That's called the pincer grasp. Okay, this is the order, guys. First, we expect them to be able to turn prone to supine, supine to prone. We see that around 3 to 5 months. And then them having the ability to sit. Now, remember, before they can sit, they have to actually have the ability to straighten their back, right? But after being able to turn, we expect them to have the ability to sit. We see that 6 to 7 months. And then from sitting, them having the ability to crawl on the hands and knees, we see that around 8 to 9 months. And then last, having that pincer grasp, we see that around 10 to 12 months. All right, you're performing a neurocheck on a 7-month-old infant. What reflex should the nurse be able to elicit? So you're doing a Neurocheck, the infant is 7 months old. Which reflex should you still be able to elicit? Would it be the Moreau? Would it be the Babinski? Would it be the tonic neck? Or would it be the palmar grasp? Okay, very good. Most of you got it right. It's the Babinski. Erin said babushka. It's the Babinski reflex. And the Babinski reflex should disappear by 12 months. And if that child's 1 year old or older and you elicit that Babinski reflex, you have to report it to the healthcare provider. And you expect for them to be referred to neurology because usually that's indicative of some type of neurological deficit. Okay. Select all that applies. Which behaviors would be expected of an 8-month-old infant? Here's your choices: stranger anxiety, playing peekaboo, drinking from a cup, the ability to remove some clothes, standing by holding onto furniture, and the ability to cruise or cruising. Which behaviors would be expected of an 8-month-old infant? Okay, let's talk about it. Let me move this. So 8 months, stranger anxiety, absolutely. That infant can tell the difference between family, primary caregiver, and strangers. Peekaboo, yes. Why peekaboo? NCLEX is big on this as well. So make sure you understand why peekaboo, because they've developed what? Object permanence. They understand even if they can't see something, it's still there. So they'll do peekaboo and they just love it. They love playing peekaboo. Um, Standing to hold on to furniture. Absolutely. These are behaviors we'll see in an 8th month. Now let's talk about the wrong choices. What about drinking from a cup? Let me tell you when we expect that milestone to be achieved. The big milestone, the 12 months, right? Once that infant's 12 months, they're moving into toddlerhood. They're moving from formula or breast milk to cow's milk. And they are also moving from bottle to sippy cup. All right. They should be able to drink from a cup. They should be able to hold their own sippy cup. So we see that at 12 months. Next, the ability to remove some clothes. We see that by what? 18 months. And last, the ability to cruise. NCLEX uses that term cruise or cruising, but some PEDS books don't use that term. So let me tell you what that is if you're not familiar. That's when the child's holding on to furniture, not only to stand, but to also walk. So they're moving from one place in the room to another by holding on to items. That's called cruising. And we should see that by 11 months old. All right, one more slide. Why should medications and chemicals be kept out of the reach of toddlers? Is it that they have an increased metabolic rate? Is it that they have a high level of oral activity? Is it that they're obtaining a sense of taste? Or is it that they are rebelling against parental authority? Why should medications and chemicals be kept out of the reach of toddlers? What's the point? Why are we locking those chemicals up? Very good. They have a high level of oral activity. Anything they get their hands on, what do? They put in their mouth. Okay. And we don't want them ingesting any of these medications or chemicals or poisons. Speaking of poisons, something else is very important for you to know. Something as simple and you would think it's not dangerous. House plants, for children, they are dangerous because many house plants are poisonous if ingested. As adults, we know better. We're not going to ingest leaves of house plants, but children don't know better. So even house plants, you have to have away from the pediatric patient, because guess what? They could put it in their mouth, they can ingest it. So anyway, the other choices are wrong. Look at the first one. They have an increased metabolic rate. Well, yes, toddlers do have an increased metabolic rate, but that's not why we're keeping poisons and chemicals and medications away from them. We're keeping away from them because we don't want them to ingest it. Next, they are obtaining a sense of taste. Well, that makes no sense. They're born with a sense of taste, so that's wrong. And then last, they're rebelling against parental authority. Which age group do we see rebelling against parental authority? It's not the toddlers. I mean, they do it, but I mean, not a lot, right? The toddlers love saying no. Why? Because they're trying to develop autonomy. But who really rebels against parental authority? It's the adolescents. Remember, the adolescents, they're the ones who their job is to figure out who they are, their identity, and they do it through their social groups, and they want independence. And part of that process sometimes is rebelling against parental authority. But in this question, we're talking about toddlers. So that's why the answer is increased oral activity. All right, guys, this was a quick video. Thank you for watching. Let's see how you did, the people who are on the live.